Hi Karen, thanks for coming in today. And I'd like to start out if you just tell us a little bit about yourself.
I'm a Tulsa native. I've been a patient of Dr. Flournoy's for several years. I was really excited when he told me about the ReGen med that they were going to be doing stem cell replacement. One of the things he and I had been working on for a while was my left knee.
Okay, before your stem cell injections, what types of treatments have you had for your knee?
Icing it, some strength training. I'd gone to see an orthopedic surgeon and actually had arthroscopic surgery on my left knee in 2016. It actually made it worse.
Okay. Prior to getting your stem cell injection, talk about your daily activities and any restrictions that you had in everyday life.
My restrictions were pretty significant for me. When my knee kind of went south on me, I was not able to ride my bike. I have a 125cc scooter, and when I stop at the lights, I have to lean on that knee to hold my bike up. And I was unable to participate in the activities that my family had, whether it was hiking or 5Ks, even just going camping and getting around the campsite would give me trouble. And a full day activity on my knee would end up with swelling. It was like having jello on top of my knee. It just jiggled. There was so much fluid. And that would pretty much incapacitate me for a few days after that. And I was having trouble sleeping at night too, because when my knee would touch the other knee, it was just really painful.
On a pain scale level, 1 to 10, before the injection, where would you say you are on an average day?
On an average day, I would say like a 5 or 6, which is you're aware of it, but you can continue your basic activities. But on days that it got bad, it would be an 8, and I would just have to sit in a chair and ice, and was pretty much just a schlub in the chair.
Okay. You're at approximately your 3-month follow-up.
Mm-hmm.
Now talk about your daily activities and any restrictions that you may have.
I don't have any restrictions. I was unable to do stairs before, and now I can do stairs. And not just like stairs going into a building. I took a cruise and I was able to go up and down throughout the cruise ship once. I lost something and I was like 9th floor to 6th floor to 4th floor, back to 9th floor, and I didn't have any after effects the next day from that. And I really expected to have after effects. Recently we came back from Colorado and I got to do a 2-mile hike around the Royal Gorge Rim, and I didn't have any after effects the next day. Didn't have any swelling, did not affect the rest of my vacation at all. I'm riding my scooter, I'm getting ready to start riding my bicycle, and I've walked a 5K and never had any bad issues afterwards.
Okay, that's awesome to hear. I'd like to ask, did you have any apprehension to having stem cells here at ReGen Med with Dr. Flournoy and Dr. Anthony? And if you did, talk about them, but then actually talk about after you had the injections, how you felt.
I was a little apprehensive because I thought it was going to be similar to getting a flu shot or a B12 shot, that it would hurt going in and I would have soreness afterwards. And I didn't. I believe that Dr. Anthony and Dr. Flournoy and I, all three of us, were surprised how quickly it went in. It didn't hurt. I've had more after effects from getting my flu shot than I had from this.
Great. Once you had the injection, how long did it take before you felt relief?
I started feeling relief within the first week or two, and I didn't have any pain after having the injection. It was great.
What is your pain level now on an average day? You said earlier it was about a 5. What would it be today?
I don't have any pain in my left knee today. Even after my activities, I don't have any issues.
Thank you. Do you have any recommendations out to patients that are considering this option here at ReGen Med?
I highly recommend it. I've talked to my husband about possibly getting one in his left shoulder, which has been giving him trouble for a few years, and nothing seems to be helping. I think in the future, if I have trouble with any other joint, this will be my first step before I ever consider surgery. So.
Okay, great. Thank you for your time, and we wish you continued success.
Thank you.